doing today?
Good.
My name's Ashton. I'm going to be your student nurse. Can you please state your name and date of birth?
My name is Electra. My date of birth is 4/23/05.
Okay, and how old does that make you?
15.
Awesome. And what brings you in today?
Physical.
Okay. And what gender do you identify with, Electra?
Female.
Okay. And what do you do? Are you in high school?
Yes, I'm in 10th grade.
Awesome. Getting ready for college? A little stressful, I bet, huh?
A little bit, yeah.
Alright. And do you eat lunch at school?
I usually bring my own.
Okay, good. So you appear your stated age. You are alert and conscious. Your skin appears pink and dry. You have, well, it appears that you have good nutrition. You have good posture. I'm not noticing any physical deformities. You seem to have adequate hygiene, good mobility. Your gait appeared normal when you walked in. You have good facial expressions and mood and affect. You seem to be able to hold a conversation with me well. Your speech seems good. You're able to articulate your words very well, and you seem to have good hearing as well. So for the first part of our assessment, can I just see your hands, please? And let me know if you experience any pain throughout our assessment, and we can stop. Okay. I'm not noticing any lesions or bruises. Your skin is warm, pink, and dry. I'm just going to test your turgor. Good. You seem to be well hydrated. And your capillary refill is less than 3 seconds, which is awesome. Okay, now I'm going to move on to your head. Just feeling if your cranium is intact. All right, your scalp feels warm and dry. You seem to have normal hair distribution. I'm not noticing any signs of alopecia. Are you experiencing any pain?
No.
Okay, good. I'm not noting the presence of any lesions or bruising. Okay, and now I'm going to palpate your temporomandibular joint. Can you clench your jaw for me? And move it side to side. Awesome. Now I'm just going to test your sensation on your face. If you could just close your eyes and say now when you feel my cotton swab. Close your eyes, please. Okay, good. Cranial nerve 5 is intact. And now I'm going to move on to your eyes. So if you could just stare straight ahead. I'm going to pull my fingers in from the side. Just let me know when you see them wiggling.
No. No.
Okay, you have good peripheral conformation, so cranial nerve 2 is intact. And now if you could keep your head straight and follow my finger with your eyes only. Okay, cranial nerves 4 and 6 are intact as well. Now I'm going to check your pupillary reflex and accommodation. So if you could look at my left ear, I'm going to shine a light in your eyes. Just try not to look directly at it. Good, and now my other ear. Okay, good. You have good pupillary reflex as well as accommodation, so cranial nerve 3 is intact. Now I'm going to move on to your ears. Are you feeling any pain or tenderness?
No.
Okay. I'm not noticing any lesions or bruising. Your skin is warm, pink, and dry. And I'm going to test your hearing. So if you could close your eyes for me and just let me know when you hear my fingers rubbing together. Close your eyes for me.
Here.
Good. Cranial nerve 8 is intact. Now I'm just going to check your sense of smell. Just give me one moment. I'm gonna put some alcohol on cotton swab. Okay. If you close your eyes for me and cover one of your nostrils, and just let me know when you can smell this. Okay, and now the other.
Smell.
Awesome. Cranial nerve 1 is intact as well. Now I'm going to move on to your mouth. Have you been experiencing any pain in your mouth, any toothaches or lesions?
No.
Okay, good. Can you show me your teeth, please? All right, your teeth look good. Your gums are pink and shiny. Your lips are pink and moist. Now can you stick your tongue out and say ah? Okay, I'm just gonna depress your tongue. Okay, your hard and soft palate are pink and shiny. Your uvula is midline. Your soft palate rises. Your gag reflex is intact, and you seem to be handling your secretions well. Can you swallow for me? Okay, awesome. Cranial nerves 9 and 10 are intact. And could you frown for me? And show me your teeth. Smile. Puff up your cheeks with air. Stick your tongue out. And say light, tight, dynamite.
Tight, tight, dynamite.
Awesome. Cranial nerves 7 and 12 are intact as well. Okay. Just let my hands dry a bit. And the next body portion we're going to work on is your neck. Have you been experiencing any neck pain lately? Awesome. Okay, I'm not noticing any lesions. Your skin appears dry and pink. Your skin is warm to the touch. I'm not feeling any lumps or bumps. Okay. Your trachea is midline. Now I'm going to palpate your carotid artery. Okay, your carotid pulse is present and normal bilaterally. Now I'm just going to take a listen to your carotid artery. If you could just hold your breath for me, and if you get dizzy at any point, let me know and we can stop. Okay, take a couple breaths. Okay, and hold it again. Okay, good. That sounded within normal limits, and I didn't note the presence of any bruise. We're now going to move on to your chest and lungs. So if you could swing your legs this way with your back facing this direction. Okay, so can you step straight with me? Thank you. You appear to have a good thoracic cage configuration. I'm not noting the presence of any lesions or bruising. Your skin appears pink and dry. Okay, I'm going to put my fingers at about ribs 9 and 10 and test your symmetric expansion. So could you breathe in nice and deep for me? And out. Okay, good. You have good symmetric expansion. And now I'm going to test your tactile primitus. So every time you feel my hands touching your skin, if you could just say 99.
Okay. 99. 99. 99. 99. 99. 99.
Okay, good. I could feel some nice, clear, even vibrations there, so that's awesome. Now I'm just going to palpate around. Experiencing any pain or tenderness?
No.
Okay. I'm not feeling any abnormal lumps or bumps. Okay, and now I'm going to take a listen to your breath sounds. So when you feel my stethoscope touch your skin, just take a nice deep breath in and then exhale for me. Awesome. Okay, good. Your breath sounds sounded clear and even, and your respirations appear unlabored. Now I'm going to check your anterior side, if you could just swing around. Okay, and again, your skin appears pink and dry. It is warm to the touch. And now I'm going to take a listen again on this side. So just like the back, a nice deep breath in and then out for me. can stand up straight, please. A little sleepy?
Yeah.
Right, sneak under here. Okay, good. And again, your breath sounded clear and even, and your respirations appear to be unlabored. Now we're going to test your upper extremities, some range of motion, and muscle strength testing. So can you put your arms up for me? Good. Just like this. And can you bend up and back down? Can you push up and flip them over? Push down. You go like this and like this. Can you make a fist? Wiggle your fingers. Spread them right apart. Okay, good. Can you try to pull your fingers out? Awesome. Awesome. Shrug your shoulders against my resistance. Turn your head against my resistance. Okay, good. Cranial nerve 11 is intact. Can you look down to your chest and up to the sky, and lean to the side, and the other side, and I'm gonna rotate around. Okay, good. You appear to have good range of motion and muscle strength for your upper extremities. Now we're going to move on to your neck vessels. So if you just lay with your head at this end for me. This up a little bit. Okay. And can you turn your head to the left for me, please? Right to the left. Thank you. Okay, I'm not noticing any abnormal pulsations, and I'm not noting the presence of any jugular venous distension, which is great. Now we're going to move right onto your heart. So I'm going to visualize your precordium. Okay, I'm not noticing any abnormal pulsations on your precordium either. I'm going to palpate your apical pulse, which is 5th intercostal space, mid-clavicular line. Okay, your apical pulse is present and normal. I'm now going to palpate across your precordium. Let me know if you experience any pain. Okay, your skin is warm, pink, and dry. I'm not feeling any crepitus, and I'm not noting the presence of any thrills, which is great. Now I'm going to take a listen to your heart sounds. Starting with your aortic valve, which is 2nd intercostal space, right sternal border. Okay, and pulmonic, 2nd intercostal space, left sternal border. And tricuspid, 5th intercostal space, left sternal border. Okay, and your mitral valve and apical impulse, which is 5th intercostal space, mid-clavicular line. Okay, just gonna take another listen with the bell on my stethoscope. Okay, and I'm going to listen to your apical pulse for 1 minute. Okay, good. Your apical rate was 62 and normal. I was able to hear a nice clear S1 and S2. Now we're going to move on to your abdomen. You can just lower the waistband of your shorts to your hip bones for me, please. Awesome, thank you. Okay, so I'm noticing good contour and symmetry. Your skin appears pink and dry. Your umbilicus is midline. I'm not noticing any abnormal pulsations. Okay. Now I'm going to take a listen to your bowel sounds. Just try your best to relax, okay? Starting in your right lower quadrant. Okay, your bowel sounds are within normal limits. I didn't hear any bruits. I'm now going to listen to your vascular sounds. Those sounded within normal limits as well. Now I'm going to percuss in your 4 quadrants. So again, you're just going to feel me tapping on you, but it shouldn't hurt. Let me know if you experience any pain. Okay, good. That all sounded within normal limits as well. Now I'm going to start some palpations. I'm going to start with lighter palpation and then a little deeper. Are there any areas of tenderness I should know about?
Like around here.
Okay. Okay, awesome. Just let me know if you feel any pain. You feeling okay? In here as well? Okay, now I'm going to move on to a little bit of deeper palpations. Still doing okay? In here as well? Okay, good. So I didn't feel any abnormal masses and I didn't know any enlarged organs, which is great. So we're going to move on to your lower extremities. If you could just put your legs down. Awesome. So you seem to have good symmetry. You appear to have normal hair distribution. Your skin appears pink and dry. Just going to feel your skin a little bit. Okay. Your skin is warm to the touch. I'm not noticing any lesions or bruising. I'm now going to palpate some of your pulses, starting with your dorsalis pedis. Okay, dorsalis pedis is present and normal bilaterally. And now your posterior tibial, which is also present and normal bilaterally. Can you wiggle your toes for me? Awesome. Now we're going to move on to some range of motion and muscle strength exercises. Can you spread your legs for me? Okay, and bring it back together. Can you bring one knee up and plant your foot on the table? Pull your knee out and back in and bring it back down. Same with the other leg. Out and in. Awesome. Bring it back down. Can you push up and push down? Good. Can you bring your feet inward? Awesome. And out. Great. Okay. And now I'm going to have you stand up for me, please. Okay. Can you walk down there and back for me, please? Okay, good. this way. Can you lift one of your knees up for me, please, behind you? And push down, push back up. Okay, bring it back down. And again with the other, push up and push down. Awesome, you can take a seat again. So you appear to have good range of motion and muscle strength for your lower extremities as well. Now we're just gonna do a simple neurologic test. So I'm gonna have you close your eyes, and I'm going to touch you with two objects, either a pointy, or you can say sharp, or soft. And I just want you to close your eyes and let me know whether you're feeling a soft touch or a sharp touch.
Sharp. Soft. 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 Sharp. Sharp. Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft.
Okay, good. That all seemed within normal limits. Okay, now we're going to test your cerebellar function. So can you bring your finger from your nose back to my finger? Awesome. And can I have you stand up for me one more time? Okay, I'm going to conduct a Romberg's test. So try not to hold the table, but we're going to keep you close to it just in case you need to gain your balance again.
Okay.
So I'm going to have you put your feet close together. Right together with me. Awesome. And hands next to your side, and close your eyes for 20 seconds. Okay, you were good, and you have a negative Romberg's test. You appeared to have good balance, so you have good cerebellar function. You can take a seat back up here for me. Now we're just going to do a couple coordination tests, and then we'll be able to end our exam today. Okay. Can you touch your thumb to all your fingers? Awesome. And can you run your heel up your shin? Yep. Awesome. Do you have any questions for me today?
No.
Okay. Well, that concludes our physical assessment. Thank you for your time.
Thank you.